Hi everybody. We are here to discuss AFB. So let's start. Introduction. Ziehl-Neelsen staining, acid-fast, technique is a differential staining technique. It was initially developed by Ziehl and modified later by Neelsen, hence the name Ziehl-Neelsen stain. Neelsen used carbonyl fuchsine with heat and added a decolorizing agent acid alcohol and counterstain methylene blue. The use of acid alcohol in the technique, so it is called as acid-fast stain. Where do we use this? Ziehl-Neelsen method of staining is useful in detection of acid-fast organisms. Microorganisms that are not easily stained by basic stains such as gram staining, negative staining. Examples: Mycobacterium, Actinomycetes, Nocardia, Cryptosporidium etc. Number of bacilli in the smear may be counted and correlated with infectiousness of the person. This is important for epidemiological purpose. This is useful in following a patient's response to treatment. To know the drug resistance. If organisms fail to decrease after therapy in the smear, the possibility of drug resistance must be considered. Mycolic acid. The cause for acid fastness. In simple words, resisting the acid. These microorganisms have thick cell wall made up of lipoidal complexes known as mycolic acid. Mycolic acid. On its cell wall, making it waxy, hydrophobic and impermeable. Mycolic acids are beta-hydroxycarboxylic acids made up of 90 carbon atoms. Defines the acid fastness of the bacteria. Principle. How it will work. The Ziehl-Neelsen stain uses basic fuchsine and phenol compounds to stain the cell wall of Mycobacterium species. Basic fuchsine in combination with phenol penetrates the cell wall and stains the bacilli bright red. Once stained, they resist decolorization with strong acid. Mycobacterium does not bind readily to simple stains. Use of heat along with carbonyl fuchsine and phenol allows the penetration through the bacterial cell. The basic dye in combination with mineral acid forms a yellowish-brown compound which easily comes out of the non-acid-fast bacilli after decolorization but not out of the acid-fast bacilli. Counterstaining with methylene blue is done to form a contrast to red-colored acid-fast bacilli. Reagents we need. Ziehl-Neelsen carbonyl fuchsine. Basic fuchsine, powder, 5 grams. Phenol, crystalline, 25 grams. Absolute alcohol, ethanol, 50 milliliters. Distilled water 500 milliliters. Sulfuric acid 20% percentage may differ, depends on the organism. Loeffler's methylene blue 0.5, break, %. What are the requirements? Slides. Spirit lamp. Nichrome loop, stick. Glass marker. Normal saline. Distilled water. Liquid paraffin, cedar wood oil. Gauze piece. Light microscope. Procedure for AFB. Firstly, we have to prepare the smear. First, take a new slide and make an oval-shaped mark at the center by using a glass marker. Make a smear from blood-tinged or yellow purulent portion. Remember, it should be from blood-tinged or yellow purulent portion of the sputum using a stick in the pre-marked area. Otherwise there will a chance of false negative. Allow the smear to air dry for 15 to 30 minutes. Fix the smear by passing the slide over the flame 3 to 4 times. Now comes the procedure of heat staining. 4 steps in heat staining. Step 1. Place the slide on the staining glass rods with the smeared side facing upwards. Pour filtered carbyl FUCHSIN over the slide so as to cover the entire slide. Wait for 5 to 8 minutes. Next. Step 2. Heat the slide underneath until vapors start rising. Do not allow carbyl fuchsin to boil or the slide to dry. Continue the process for 5 minutes. Wash both sides of the slide with tap water. Step 3. Cover the slide with 20% sulfuric acid. The red color of the preparation is changed to yellowish brown. After about a minute in the acid, wash the slide with water, and pour on more acid. Repeat this process several times. The object of the washing is to remove the compound of acid with stain and allow fresh acid to gain access to the preparation. The decolorization is finished when, after washing, the film is only faintly pink. Decolorization generally requires contact with sulfuric acid for a total of at least 10 minutes. Final step. Counterstain with Loeffler's methylene blue for 15 to 20 seconds. Wash with water. Place the slide in slide tray and allow it to dry. Put a drop of oil on the stained area and observe under oil immersion, 100x magnification. Let's summarize. Step 1. Primary stain. Pool with carbyl fuchsin for 5 to 8 minutes. Step 2. Mordant. Fix with heating for 5 minutes. Do not allow carbyl fuchsin to boil or the slide to dry. Step 3. Decolorize. Pool with sulfuric acid. Repeat the process until smear turns into faint pink in color. Step 4. Counter stain. Pool with methylene blue. 15 to 20 seconds. Finally air dry and observe under oil immersion, 100x magnification. Now comes the modifications. A solution of 3% HCl can be substituted in place of 1% sulfuric acid. The sulfuric acid solution does not decolorize as strongly as the hydrochloric acid. This makes it useful for staining organisms that are weakly acid-fast, such as nocardia. Brilliant green may be substituted for methylene blue as a counterstain, resulting in non-acid-fast organisms appearing green rather than blue. Let's see some of the modified AFB staining. Cold method with Gabbitt's methylene blue stain, which is widely practiced. The smear is flooded with basic fuchsin phenol stain and allowed to stand at room temperature for 10 minutes and counterstain Gabbitt's methylene blue stain for 2 minutes. Another cold method, Quignon's method. Done for nocardia and Legionella, resist decolorization by 1% cold sulfuric acid. We'll discuss about Gabbitt's and Quignon's method in coming slide. Acid-fast stain using by 5% sulfuric acid. Mycobacterium leprae resist decolorization by 5% sulfuric acid. Spore staining we should know. Muller's method. Derner's method. Schaefer-Fulton stain. Muller-Chermak-Turgotol method. What is Gabbitt's methylene blue? It can be prepared with 1 gram of methylene blue, 20 milliliters of sulfuric acid, 30 milliliters of 95% ethanol, 50 milliliters distilled water. In the next slide we will discuss about cold method of AFB staining with Gabbitt's methylene blue. Cold method with Gabbitt's is very simple. It's a two-step procedure, as we mentioned in the earlier slide. Step 1. Place the slide on the staining glass rods with the smeared side facing upwards. Pour basic fuchsin phenol over the slide so as to cover the entire slide. Allow to stand at room temperature for 10 minutes. Wash the slide with tap water. Second and final step. Counterstain with Gabit's methylene blue for 2 minutes. Wash with water. Place the slide in slide tray and allow it to dry. Put a drop of oil on the stained area and observe under oil immersion, 100x magnification. Another cold method we mentioned in earlier slide. Quignon's cold method. 3-step procedure. The procedure for Quignon staining is similar to the Ziehl-Neelsen stain, but does not involve heating. The Quignon staining method uses carbol fuchsine as a primary stain, followed by decolorization with an acid alcohol solution and methylene blue as a counterstain. Quignon carbol fuchsine has a greater concentration of phenol and basic fuchsine and does not require heating in order to stain properly. Results. It looks very simple. But we should examine the whole slide at least for 5 to 10 minutes. Acid for bacilli will appear as BRIEGTOR pink against blue background. The rest, that is pus, squamous epithelial cells, elastic fibers, which cannot resist acid will appear in blue. Interpretation. Acid-fast bacteria retain primary dye, carbol fuchsine, pink in color. Example: Mycobacterium, Cryptosporidium, Nocardia, Isospora etc. Non-acid fast bacteria does not retain primary dye, which is blue in color. Grading of microscopy smears. 10 or more AFB in each oil immersion fields as 3+. 10 or more AFB in entire smear, that will be 2+. 3 to 9 AFB in entire smear as 1+. 1 or 2 in entire smear will be reported as scanty. How to prevent false positive sputum results. Ask the patient to rinse the mouth with water before collecting sputum sample. There should not be any food particle or fiber in the sputum sample. Use only new, unscratched slides. Always use filtered carbol fuchsine. Do not allow carbol fuchsine to boil during staining. Decolorize adequately with sulfuric acid. Never touch the oil immersion applicator to a slide. Always clean the oil immersion lens after screening each smear. How to prevent false negative sputum results? Make sure that sample contains sputum and not just saliva. There should be enough sputum, at least 2 milliliters. Select thick, purulent portions to make the smear. Fix the smear with correct length of time. Prepare smear with adequate material. Stain with carbol fuchsine for 5 to 7 minutes. Do not decolorize with sulfuric acid too intensively. Examine every smear for at least 5 minutes, observing at least 100 fields before recording as negative. Let's start the discussion. What do you mean by acid fastness? Acid-fast bacteria do not stain readily with dilute solutions of dyes. But they do stain when heated with a strong dye solution, and once stained they resist decolorization even by strong mineral acid. The mnemonic is LMNOPQRST. Legionella. Mycobacterium. Nocardia spp. Oocysts of Cryptosporidium parvum. Protozoa, Isospora, Cyclospora. Q. Nothing. Rhodococcus spp. Spores, sperm head. Taenia. What are the factors which affect acid fastness of an organism? Age of colonies. Medium on which growth occurs. Ultraviolet light. Lipid content and integrity of the cell wall of the organism. Why tubercle bacilli are acid-fast? Due to the presence of mycolic acid in their cell wall. Why heating of carbylfuchsine is necessary in Zeal-Nielsen staining? Heating helps in penetration of dye, carbylfuchsine, through waxy coat surrounding the cell wall of mycobacteria. What are the other methods of acid-fast staining? Quinone acid-fast stain. Fluorochrome stain. Why quinone acid-fast stain method is known as cold method? The quinone stain is known as cold stain because the high concentration of phenol in the reagent serves to dissolve the lipid material in the cell wall, allowing penetration of the carbylfuchsine dye without the use of heat. Which method of staining is most useful screening procedure? Fluorescent dye staining. Auramine-rhodamine stain, AR. What are the advantages of fluorescent staining over Zeal-Nielsen staining? Fluorescent staining is more sensitive. No heating is required. Slide is scanned under low power and hence scanning is quick. Positive fluorescent smear may be restained by Zeal-Nielsen or quinone procedure, thereby saving the time needed to make a fresh smear. Mycobacteria appear as bright luminous yellow rods against a dark background. What are the drawbacks of fluorochrome staining? Many rapid growers, for example Mycobacterium chelwanae, Mycobacterium fortuatum, may not appear fluorescent with these reagents. Fluorescence microscope and reagents are expensive. Expert hands are required to distinguish between positive bacilli and artifacts. What are the limitations of acid-fast staining? Smear must always be correlated with culture results. Organisms other than mycobacteria may demonstrate various degrees of acid fastness. Rapidly growing mycobacteria may stain poorly or acid-fast variable. What is the number of bacilli which must be present in the sputum for detection by direct microscopy? 50,000 to 100,000 bacilli per milliliter. What is the minimum number of bacilli which must be present in the sputum for detection by direct microscopy while using standard concentration technique? 10,000 per milliliter. Can we use counterstain other than methylene blue? Yes, malachite green may be used. Next question. What is the disadvantage of malachite green? This is a strong counterstain and may mask the presence of Afb. Next question. Can we decolorize the smear with acids other than sulfuric acid? Yes, nitric acid or hydrochloric acid. Next question. What is the role of phenol in carbylfuchsine? It acts as mordant. It also makes the cell surface easily penetrable for basic fuchsine by dissolving fats. Which method is more sensitive, Zeal-Nielsen or quinone? Zeal-Nielsen is more sensitive. Weak acid-fast strains of rapidly growing species may stain better with Zeal-Nielsen than quinone. Next question. What is the concentration of sulfuric acid used for decolorization of various acid-fast organisms? 20% for Mycobacterium tuberculosis and atypical mycobacteria. 5% for Mycobacterium leprae. 1 to 5% for Cryptosporidium. 1% for Nocardia species. 0.5% for bacterial spores. How can you differentiate smegma bacilli present in the urine from M? Tuberculosis? M. Tuberculosis is acid and alcohol fast while smegma bacilli, commensals, are only acid fast. Next question. Culture medium for Mycobacterium? Lowenstein-Jensen, L.J., medium. Procedure for specimen collection. In pulmonary tuberculosis. Sputum, 2 specimens, spot in early morning, gastric aspirate, in children. In extrapulmonary tuberculosis. Specimens vary depending on the site involved. Next question. Sputum concentration methods. Modified Petrov's method, 4% NaOH. NALC, N-acetyl L-cysteine, plus 2% NaOH. Next question. Direct microscopy by acid-fast staining. Ziel-Nielsen, ZN, technique, long slender, beaded, less. Uniformly stained red color acid-fast bacilli. Kinyun's cold acid-fast staining. Fluorescent, auramine, staining. It is more sensitive and smears can be screened more rapidly than ZN stain. What are the molecular methods available for diagnosing tuberculosis? PCR detecting IS6110 gene. cBNAAT, Gene Expert, and TrueNat, for identification and detection of resistance to rifampicin. Has a turnaround time 2 hours. Line probe assay, for example genotype TB, for identification and detection of resistance to first and second line ATDs. Has a turnaround time of 2 to 3 days. What is the culture media used to grow Mycobacterium? Conventional culture media, takes 6 to 8 weeks. Lowenstein-Jensen, L.J., medium, shows rough, tough and buff-colored colonies in 6 to 8 weeks. Next question. What is automated culture methods available to grow Mycobacterium? Automated culture methods, take 3 to 4 weeks. MGIT system. Detects growth as well as resistance to antitubercular drugs, ATDs. Next question. Latest culture identification. Automated identification, by MALDI TOF. MPT64 antigen detection, by ICT. Morphology of the colony on LJ medium. Cultures should be read within 5 to 7 days after inoculation and once a week thereafter for up to 8 weeks. Colonies are typical non-pigmented, rough, dry colonies are seen on LJ medium. The green color of the medium is due to the presence of malachite green, which is one of the selective agents. These are other alternatives for LJ medium for culturing Mycobacteria. Culture remains the gold standard for laboratory confirmation of TB disease. And growing bacteria are required to perform drug susceptibility testing and genotyping. But the gold standard method takes several months to culture positivity. A number of novel molecular technologies have in recent years to achieve quicker confirmation the diagnosis. PCR. cBNAAT. LAMP, that is loop-mediated isothermal amplification. LAMP is a single-tube method that is less expensive than other methods for amplifying DNA. Few points on cBNAAT. cBNAAT is a qualitative, nested real-time polymerase chain reaction, PC, in vitro diagnostic test. The testing of either 1 or 2 sputum specimens by the cBNAAT may serve as an alternative to serial acid-fast stained sputum smears as an aid in the decision of whether continued infection control precautions are warranted. cBNAAT also detects the rifampin resistance-associated mutations of the RPOB gene. cBNAAT is intended for use with specimens from patients for whom there is clinical suspicion of tuberculosis, TB, and who have received no antituberculosis therapy, or less than 3 days of therapy. Procedure is simple. Sputum liquefaction and inactivation. Transfer of 2 megaliters sample into test cartridge. Cartridge inserted into MTB test platform. The hands-on work will end here. Sample will be automatically filtered and washed. Ultrasonic lysis of filter captured organisms to release DNA. DNA molecules mixed with dry PCR reagents. Real-time amplification and detection in integrated reaction tube. Finally, printable test result. This NTEP, that is National TB Elimination Program. Diagnostic algorithm for drug-sensitive TB. These are the treatment algorithm. There is no more category. But same regime for drug-sensitive patients, which is first-line drugs. Isoniazid. Rifampicin. Pyrazinamide. Ethambutol. As initial phase. And isoniazid. Rifampicin. Ethambutol. Continuation phase. Rifampicin resistance and multi-drug resistance have to start with second-line drugs. And for prophylaxis, isoniazid and rifampin or rifapentine, not rifampicin. Thank you very much for patience. Thank you for watching.